Good evening and welcome, everybody. My name is Joyce Knight. I am the Associate Dean for Student Academic Affairs and Advising in the College of Arts and Sciences here at Loyola University. On a personal note, I've been at Loyola for 40 years. I'm the wife of an alum, the mom of an alum, a mother-in-law of an alum, and if my granddaughter comes here in the fall, I'll be a grandmother of an alum. Tonight, we have more than 1,500 participants registered for this event, and we are very grateful for your interest and your participation. Tonight, we will hear from Loyola leaders about our vision for spring, and we hope to provide a sense of what the academic and student experience will look like, which will include the following topics: Loyola's phased reopening for spring, an increase of residential students in on-campus housing, increased proportion of in-person classes, an overview of Rambler community care, compliance, and testing. And then I ask that you would please join me in welcoming our panel members: Jo Ann Rooney, President of Loyola University; Norberto Grzywacz, Provost and Chief Academic Officer; Kana Henning, Associate Vice President for Facilities; Joan Holden, Director of the Loyola Wellness Center; David Shoham, the Associate Director and Director of the Master of Public Health Program; Marissa Lucchesi, Director of Student Activities and Greek Affairs; and last and not least, the star of our show, Madeline Drescher, President of Student Government of Loyola University Chicago. After each speaker discusses a topic tonight, there will be a question and answer period. Questions have been gleaned from those that you've already sent to us or those that you are asking tonight. The questions will be directed to one of our experts on the panel. We expect that our webinar will conclude around 7:30 p.m. This event is being recorded and will be posted to the Return to Campus website this week. And at the end of this, you'll see some slides and it will give you a link to that as well. We hope that you find this evening helpful and informative. Now it is my pleasure to turn it over to Dr. Jo Ann Rooney, President of Loyola University Chicago. Dr. Rooney.
Thank you, Joyce. Good evening, everyone. And thank you for connecting with Loyola University Chicago this evening. On behalf of our entire Loyola Chicago community, please accept my deepest appreciation for the flexibility, fortitude, adaptability, and compassion shown by our students, families, faculty, and staff throughout this COVID-19 pandemic. Choosing to further your education at a comprehensive university such as Loyola in a major metropolitan area that is such an integral part of our extended campus and that provides so many opportunities is particularly challenging during a global pandemic. Tonight, we will share our plans as they stand today. We do not have all the answers, but we have many, and we'll share processes, procedures, benchmarks, timeframes, and our communication plans to keep you updated. Though there continue to be many unknowns facing us despite detailed scenario planning, this I can assure you. We will always keep the health and safety of our students, faculty, and staff as our #1 priority. We will continue to devote our full effort to innovate solutions, manage in accordance with science, data, and the guidance of public health experts, and listen to the ideas and concerns of all of our community members and neighbors, both on and off our campuses. This has been a long, frustrating, exhausting year that actually began last February. Like many of you, we thought that by this fall semester, we would have to do things differently, but that we would have been able to have many more in-person classes, residents, and activities. Considering the rapidly changing information, unpredictable nature of the virus and government mandates, we had to change our carefully crafted plans to continue this fall with primarily online courses and minimal occupancy of our residence halls. This uncertainty and ability to make any concrete plans has been difficult, and we readily acknowledge the sacrifices, collective adjustments, resetting of expectations, and moments of disappointment and disruption. As we gather tonight in late November, roughly 10 months after all of this began, again, we are witnessing rapid transmission of COVID-19 in all 50 states, hospitalizations increasing and stretching our health resources to the limits, and more people and family members getting ill and even dying every day. But throughout this year, we have learned more about the virus, more about mitigation strategies, more about how best to support our students, more about keeping our campus community and neighborhoods safe. Tonight, we are focusing on our planning for this spring semester 2021, our guiding principles and timelines. Our panelists will discuss the extent to which we can increase the proportion of campus activities, how we can safely house a greater number of students on campus, and the ways we will implement testing and care for those who must isolate or quarantine. Our planning for the future is not based on months, but on weeks and days in a dynamic environment. From the beginning of the pandemic, we have leaned on data, science, public health expertise, and best practices, along with our interdependence on local and state regulations and conditions. As I turn this over to my colleagues, it is important to acknowledge something we have all come to learn. The virus has its own agenda. The virus has its own timeline. The possibility of a vaccine is hopeful, but right now, the virus is driving our planning processes, and the virus is driving our need to be patient and flexible, but unwavering in our commitment to health and safety. We have made detailed preparations from various scenarios, as you will hear, but we still have more important decisions ahead of us. But despite all these preparations, bluntly, the success of our efforts to bring more students to our campuses will rely on our students. It will be dependent on the willingness of our students to be partners with us. Take this responsibility of being good neighbors and caring for others seriously, and their willingness to insist on compliance and hold each other accountable. Those of you who join us on campus will enjoy a very special privilege. But along with that, it will require you to adhere to very clear rules and expectations. Quarantine when required. Avoid large social gatherings, wear masks, physically distance, follow the test protocols, cooperate with contact tracing, just to name a few. It will be hard, but it will be worth it. And all of this is about living our Jesuit values and mission, being persons for others, and living that day in and day out. So again, on behalf of all of us at Loyola University Chicago, thank you for sharing your time, your questions, and your feedback with us.
Thank you, President Rooney. I would now like to introduce the Provost and Chief Academic Officer, Dr. Norberto Grzywacz, who will share some remarks about the academic experience.
Thank you, Joyce, and thank you, Dr. Rooney. My name is Norberto Grzywacz. I am the Provost and Chief Academic Officer of Loyola University Chicago. So my responsibility in this webinar is to give you a summary of what will happen in the spring in the front of academics. And I'll try to focus this on the main questions that you have asked during the registration for this event. So let me begin with some of the big issues. Normally, in a spring semester, we give close to 3,500 sections of classes. Because of COVID, this spring, we will probably give around a little over 200 classes, a very small fraction of what we normally do. And why is that? As President Rooney already told you, we have to take extraordinary measures to prevent the spread of the virus. And that includes de-densifying our campuses. So those 200 classes, how did we determine what they were? What we did is we went to every school and asked them what would be important for students to have when they are in campus. And the answers are simple. The school said, if there will be on-campus classes, they should be the essential ones, and those included things like labs and clinical activities for the most part. And so those are the classes that we will have, and they must be on campus. In addition, we ask professors if they would volunteer to teach more classes on campus, and many were available to do so. And this is a mode of teaching that we call the hybrid flexible class, because different from the first set of classes, these classes will be both online and on campus. That gives students options to attend spring sections in classroom or participating online. So the classes will be offered on campus, and students could stay at home if needed. For example, if they needed to quarantine and see the class from home. So we then needed to determine which students would be on class or on campus. And basically what we decided was to ask every student that wanted to take class on campus, only those that wanted to take class on campus, to register for those classes. All of you will have the option to attend the semester entirely online if you want. And we'll have the option, some of you will have the option to take some classes on campus, a small amount, as I said in the beginning. So what would happen, for example, if you are taking a class on campus and suddenly you get sick and you need to quarantine and stay away? So if you are taking one of those must take on campus classes, what the professors have done in the fall is to work with each student to try to mitigate the problem, work individually with each student. If you are taking, on the other hand, those hybrid flexible classes that we call high flex, then of course you'll be able to take those high flex classes from your apartment. You don't have to come to campus. Just so you know, the numbers are more or less like this. We have currently 83 classes that are must happen on campus. Of those 83 sections, there is 1,311 seats, of which so far only 550 have been occupied. So that means for those classes, we still have available 750 seats. For those classes that the professors volunteered to give, the numbers are much larger. We have close to 130 sections of those, with 4,500 available seats, and we still have available 1,100 of those. So there is plenty of room, if that's what you want to do, to take classes on campus. But the majority of your courses will be online. Now, we are good at what we do. The online classes are very well regarded, those classes given at Loyola. US News and World Report have ranked us in 8th in the country in terms of the quality of our classes. And the reason is we have a lot of expertise. We have, for example, an Office of Online Learning that provides support for the professors. Professors have been taking classes, tutorials in this Office of Online Learning to be prepared. And a large number of collaborations have taken place in the Office of Online Learning to prepare better classes. We also have been running continuous surveys of students and know where classes are working and classes are not working, and can therefore tune the classes and tune our systems to avoid things like lack of engagement, too much work, Zoom fatigue, the normal things that affect those kind of classes. Another point that is important is that we are going to maintain most of our calendar for spring semester, with one notable exception. Most universities have decided, many universities have decided to cancel spring breaks, and that is to prevent the spread of COVID through travel. We feel that the students need to have rest and the faculty needs to have rest. So we, instead of having a long week of spring break, we're going to have in the spring 2 long weekends that would allow you to have that break without having too much travel happening. The start and end of classes will remain as planned, unless, of course, the spike of COVID takes a turn and we need to make some changes. So in an environment that remains subject to change, the university will continue to communicate its decisions transparently. And we encourage you, as Dr. Rooney have said, to follow best practices and rest assured that we will address surges and spikes in transmission in our community. I'm grateful for the students and families that are here today, that came to listen what are our plans. I'm grateful for your engagement and especially grateful for your resolve, because these are not easy times and it won't be easy. The pandemic has filled our life with uncertainty, but resolve is not always a thunder in your head. It's this tiny voice that comes at the end of the day and says, okay, I couldn't do it today, I'll start again tomorrow. This is what we have to do in these times of COVID. And we are certain that if the students, the faculty, the staff at Loyola work together, we can have a great semester. Thank you again. Thank you for joining us. And I'll wish you a great semester coming here.
Thank you so much, Provost Grzywacz. I'd like to now introduce the Associate Vice President of Facilities, Kana Henning, who will share some remarks about living on campus in the spring.
Thank you, Joyce. Hello, everyone. Thank you for joining us this evening. Over the past 8 months, I've had the pleasure of working with a team that's comprised of leaders across many divisions of the university, including residence life, academic affairs, ITS, capital planning, campus safety, marketing and communications, research, student complexes, athletics, and the Wellness Center. And I bring all those groups up because it really has taken a village to reimagine what campus operations look like in the face of a pandemic. This group has had spent a tremendous amount of time and care and have thought through, a lot of thought has gone into our reopening plans that place the health and safety of our community as the top priority. When you come back to campus in the spring, you will notice changes to our grounds and our buildings, and you'll see some things, new things that have been implemented. First, signage has been placed throughout campus to remind everyone that face coverings and masks must be worn at all times. That social distancing is required. You must always wear your Loyola ID, reminders to wash and sanitize your hands often, and to stay away from campus if you're ill. We've also assembled a team of ambassadors who monitor our buildings and grounds, and they ensure that everyone is complying with our health safety guidelines. That group is empowered to escalate any issues of non-compliance as they see fit. We will provide the appropriate number of reminders, but if an issue does require escalation, we will refer cases of non-compliance to a department supervisor or to the Office of Student Conduct and Conflict Resolution for appropriate action. This is important. It's going to take all of us complying with our health safety guidelines to ensure a safe reopening in the spring. Across campus, we've removed seating to help de-densify our gathering spaces, and we've placed markers on the ground to send visual signals to remain 6 feet apart. In our classrooms, we've also placed our seats 6 feet apart, and we're keeping 10 feet distance between our instructor and the first row of students. Classes will be held in oversized rooms to further promote social distancing. You'll find hand sanitizer and sanitizing wipes throughout campus, in lobbies of buildings, in your office space, in your classrooms and labs, and we're encouraging everyone to wipe down their space before and after they use it. You'll also see our housekeeping staff more visibly present throughout the day, wiping down and cleaning high touch point areas hourly. And while this is not visible, it's important that we are heading into the winter months. And as we think about the indoor environment and particularly ventilation in our classroom and academic buildings, we want you to know that a mechanical engineering consultant has studied all of our university buildings to verify that our ventilation rates, our filtration strength, and our outside air levels have been optimized for the winter months. We've installed higher efficiency filters throughout all of our campus buildings. And we're introducing additional outside air and increasing our changeover of air in our buildings above its above its normal standards to improve the indoor air environment. One of the biggest changes between the fall and the spring is the reopening of our residence halls. Our new community-wide surveillance testing program, which you'll hear about later, is the most critical component of our spring reopening plan. And it's what informed our decision to reopen our residence halls with limited capacity. Many of you listening may be moving into our halls this spring, and I will provide an overview of our housing program, recognizing that you'll be receiving many targeted communications from our residence life group over the coming weeks, and you probably already have begun to receive those. They are working very hard to work through every single detail, and they will be sharing those with you as those details are worked out. In our residence halls, occupancy will be 1 student per unit. Students will live in apartments with private kitchens and baths, or in some cases, 2 students will share 1 bathroom in a suite style configuration. Move-in begins on January 13th, and all students moving into the residence halls will be required to comply with our move-in quarantine for 14 days. This means that students will be required to remain in their residential unit for 14 days. Meals will be provided. We will provide a mix of both hot and cold meals. For students living in a unit that has a kitchen in it, you'll be provided a meal kit that has about 2 weeks worth of food in it so that you can make your own food in your kitchen. In units without kitchens, students will receive deliveries of meals to the building lobbies. And so during that move-in quarantine time, students will be allowed to leave their rooms to pick up their meals from the lobby of their building. During the first month after move-in, no visitors will be allowed in the residence halls, and that will give us an opportunity to evaluate the spread of the virus on our campus and ensure that it's safe for us to consider allowing visitors at a later point in time. So once a decision is made about visitors, that will be communicated to the residential students. After the move-in quarantine, we will allow for lounges to be accessible to our students. We know that we're going to need to provide safe space for our students to gather and socialize in the right-sized groups and spaces that we believe are safe and appropriate for them. So they will be available at a limited capacity. If you test positive and you're living in our residence hall, you will be required to isolate for at least 10 days. If you live in a unit with a private bathroom, you will be able to isolate in place. If you live in a unit that has a shared bathroom, you will be required to relocate to an isolation hall. If you have been exposed to a known case of COVID-19 and you have been deemed a close contact through the contact tracing process, you will be required to quarantine for 14 days. Students who are exposed to a known case of COVID, this is different than our move-in quarantine. they will be required to remain in their unit. If you live in a unit with a private bathroom, you will be required to remain in your unit for those full 14 days. If you live in a unit with a shared bathroom, then you will be relocated to a quarantine hall and you will not be able to leave your unit. Again, just as in the beginning of the year, meals will be provided either via a meal kit or delivery. This time delivery will be directly to your room since you will not be permitted to leave your room during quarantine. Finally, I encourage you to visit our Return to Campus website to learn more about additional campus amenities and their hours of operations. For instance, Hallis Rec Center at the Lakeshore campus and the Health and Fitness Center at the Health Sciences campus will be open with limited amenities and capacity restrictions. For instance, at the Lakeshore campus at Hallis Rec Center, we ask that you reserve your visit to the rec center. Mass will be offered at Madonna della Strada, and both the schedule and capacity will comply with city and archdiocese restrictions. And our libraries will also be open with adjusted hours. At the Lakeshore campus, we will have the IC available, but access to Cudahy Library and the Donovan Reading Room will not be permitted. At Water Tower campus, both Lewis and Law libraries will be open, and at Health Sciences campus, both the Information Commons and the Quiet Reading Room will be open as well. So I thank you all for joining us this evening, and I wish you all a happy and very healthy Thanksgiving.
Thank you so much, Kana. Before we let you off the hot seat altogether, a few questions have come in and one is floated to the top. And that one is, what happens if there's another regional lockdown in the city or state? How will that affect our Loyola students?
So Loyola has been working closely with the Chicago Department of Public Health and the City of Chicago. And we've been helping those two departments and entities actually develop their plans for what a retreat back may look like. And fortunately, Loyola's reopening plans are fairly conservative. And so therefore, we would not expect to see a significant change to our operations if there was a regional outbreak. However, we are aware after monitoring how other universities have reopened and seeing the spikes that inevitably happen on a campus whenever the campus reopens to greater density. We can anticipate that that could very well happen at Loyola. And in that case, we would be prepared, if need be, to move into a quarantine situation. We would be prepared to return to an entirely virtual, all online classes, and to host and provide all of our services virtually, just as we were forced to do in March. If that were to be the case, we would have services like student academic services, mental health services through the Wellness Center. All of that would be available virtually if we found ourselves in a situation that required us to contain a lot of our operations and move virtually for a period of time.
Thank you so much. One more question for you. As you know, students need some time away from their residence hall or their apartment. Will there be places for students to study on campus in the spring?
Yes, there will. In addition to the libraries and the student centers that I mentioned in my remarks just a moment ago, we have identified a number of spaces around campus that will be available to students to pop in and find a quiet space to study, to hold a small group study session, or to take an online class while you're on campus. So we will have spaces available so that students can get out of their rooms safely and be in appropriately sized spaces for their gathering needs or for their study needs.
Thank you so much, Vice President Henning. At this time, I'd like to introduce the Director of the Loyola Wellness Center, Joan Holden, and the Director of the Master of Public Health Program, Associate Professor David Shoham, who will give a few remarks on Rambler community compliance and testing.
Thank you, Joyce. Good evening, everyone, and I am delighted to be here tonight to talk about some details about health and wellness at Loyola this spring. We have learned so much about this virus since February and have also been studying other colleges and universities who have returned large numbers of students to their campuses, and we've learned some important lessons. Most cases on college campuses can be traced to off-campus gatherings. Classrooms and other sanctioned on-campus activities have not been a significant source of spread. Extensive asymptomatic testing and contact tracing is essential to safe operation. And third, compliance of students, faculty, and staff with mitigation measures such as masks, social distancing, and so on, as well as avoidance of large gatherings indoors, is also very essential. With that in mind, I know you're all interested in our testing plans. Students who plan to live in the residence hall will, as Kana said, be required to complete a 14-day move-in quarantine. Proof of testing before move-in is not required, and if presented, does not release a student from quarantine. This approach enables us to mitigate asymptomatic spread of virus. I am also pleased to announce that we are planning a comprehensive testing program for the spring semester. Our plan is to provide a saliva-based test to all faculty, staff, and students this spring. This test is a sensitive PCR test that's very useful as it may identify virus before a person becomes symptomatic, thereby enabling us to place people in isolation to prevent spread of virus. Our plan is to test all undergraduate students twice a week, including those in the 14-day move-in quarantine, and graduate students, faculty, and staff at minimum once per week, depending on how often they are on campus. Testing sites will be available at all 3 campuses. This is called surveillance testing, and it will be free. We will continue, as we have been doing, to provide testing to students seeking care at our wellness center. This testing is primarily reserved for students experiencing COVID-like symptoms and is a rapid antigen test. Students who need confirmatory PCR testing will have their specimens sent to the laboratory, who will then bill the student. And more details will be coming soon about our university testing in a campus-wide email. We do know that testing is an important piece, but not the only one. Other measures that we have already instituted include the use of a mobile app symptom checker. Each student, faculty, and staff are encouraged to download the app and to use it every day before they come on campus. This app allows people to review how they are feeling that particular day and to see if they have any symptoms of COVID. People who identify that they do have symptoms are encouraged to stay home and to call their healthcare provider. Students in particular are encouraged to stay home and call Dial-A-Nurse, our nurse-managed triage line. I know that many of you are concerned about students who might get sick, be it on or off campus, and you wonder how we will help them. We've been working on plans to keep in contact with students in both quarantine and isolation. Telehealth and telecounseling will be available for these students. We have also hired COVID care coordinators who will be assisting students with any special needs. And our Dial-A-Nurse triage line is available for students to call and seek advice about any concerns they may have. The 14-day move-in quarantine has also been a concern for some parents in regards to student mental health. And we know this is of concern to you. We will continue to engage and reach out to our students who face this situation. And examples of engagement include a January 11th Instagram Live Q&A with nurses to answer any questions about returning to campus. And we will continually update and promote our online resources for students and to promote our Wellness Center YouTube channel, which has recordings of topics such as mental health, connecting with friends, and more. We also offer 21 different virtual support groups ranging in topics from meditation to tips for managing anxiety and coping during COVID. And our mental health team is ready and willing and able to provide telecounseling and support through this crisis. The Wellness Center will continue as it has been since the pandemic began to provide services for all Loyola students living both on campus and off. Currently, the Wellness Center offers both in-person care and telehealth and telecounseling for students living in the state of Illinois. And lastly, a word about immunizations. We ask that all students who are planning to live in the residence hall this spring to submit their required state mandated immunizations and to get their flu shot. Limited quantities of flu shots are still available at the Wellness Center, and I encourage you all to get one. Specific information about submission of immunizations can be found on our website. And now I would like to welcome David Schoen to the webinar.
Thank you, Joan, and thank you, President Rooney and others for inviting me to speak this evening. I am an epidemiologist. This is what I trained to do. And I would like to provide some follow-up comments to Joan's discussion. So first of all, we need to remember that COVID-19 is complex. It's what we call a wicked problem, which means it resists control. Doesn't mean that we can't control it, but we need to bring out all of our guns, and not a single approach is going to work. Until we have a vaccine, we need to be wearing masks, hand washing, social distancing, testing, and following quarantine and isolation recommendations and requirements. Experts now expect that we will have a vaccine distributed in 2021, and you may have heard recent good news from Moderna and Pfizer that this is just around the corner. This is very encouraging. However, the daily infection rates are expected to peak around Christmas, and death rates are expected to peak sometime in early 2021, in January. In Illinois, the good news is that we have one of the lowest reproductive numbers. This is the number of new cases that arises from each existing case. And right now it's hovering just above 1.01. If this number falls below 1.0, it means that the epidemic is receding. And we hope this is going to be the case as we go into the spring. But of course, this is dynamic and things may change. The good news is also that masks work. Over the summer, it was reported that there were 2 hairdressers in Missouri who were both COVID positive. They were wearing masks and their clients were wearing masks. There was not a single transmission to any of their 139 clients. Unfortunately, we've seen examples at universities across the country, including my alma mater, where I received my doctorate in epidemiology, UNC Chapel Hill, where there was an outbreak right after classes began. And during this outbreak, it's encouraging to note that most of the cases were linked to off-campus events, including parties and other super spreader events. Classrooms were not a significant site of transmission, and we don't believe that classrooms are going to be a site of transmission at our university either. And with that, I'll just reiterate the requirements for quarantine when you return to campus. You must stay in a single designated home or dwelling for 14 days, and you can't do any activities outside the home or dwelling. Food and other needs will be provided for. And I want you to keep in mind that this means no walks outside, no going shopping, no visiting with friends. So please help us keep the university safe. Thank you.
Thank you, Dr. Schoen and Dr. Holden. A couple of questions for you both. As you know, this is a hot issue and people are really concerned about testing. So one of the questions is, will there be contact tracing?
Yes, I can answer that question. Thank you, Joyce. I would say probably around March, maybe April, we started a contact tracing program here at Loyola. We have 3 contact tracing leads that manage the contact tracing process on campus, and they manage approximately 30 volunteer contact tracers that work with all of our positive cases. When a case gets reported to, when a student, faculty, or staff member has a positive case, we ask them to report it to the COVID-19 report at luc.edu. This website is actually managed by the contact lead tracers. and they will then assign a case investigation for each case. I want to point out that contact tracers are very strict adherents to privacy laws. At no time is a person's name or any information about them shared with anyone in the community. It's just the fact that there was a positive case.
Thank you. Second question for you. What will happen if an on-campus student tests positive for COVID?
I can answer that one as well. I alluded to that a little bit in my remarks when I talked about the desire for us to provide as much support as we possibly can for students who are in isolation or quarantine. With that in mind, we did hire COVID care coordinators, and their job is to work with students and to address any kind of special needs they might have, especially to connect them with the medical providers should they feel worse. And they're there to really provide the support that people and students in quarantine or isolation need. And we also, as I mentioned before, we offer telehealth and telemedicine and telecounseling for these students that are in isolation and quarantine, which we anticipate will be a big help. We also offer calls from our nurses at the Wellness Center who will check in with students who have been diagnosed with COVID-19. Most students, most young adults who get COVID-19 do well. They don't typically have a lot of complications. That is most of them. So that's the good news. So we have every intention and have already done the support for our students since this pandemic began.
Okay, thank you. Final question. It's sort of a hodgepodge of questions. You've answered some of it already. But what will the 14-day quarantine look like? Will anything be open? If I'm tested positive, can I go on walks, or what can I do during that quarantine? And what if I test negative when I arrive? Can I end my quarantine early?
Well, I think David addressed the first part of that question. When you're in quarantine, you cannot go outside except to be tested. For people in the 14-day move-in quarantine, as I mentioned in my remarks, those students will be allowed to leave to get tested, that they cannot go on walks and they cannot go to the park and whatnot. David, do you have anything to add to that?
No, I think you summed it up well, Joan. You can't go outside with the exception of seeking medical care, including testing. It's the only reason you can leave your dwelling.
And I believe the other part of the question was, if I come to campus with a negative test, can I skip out of the quarantine? And the answer is no. All students who come to campus, regardless of a negative test, have to go into the quarantine, because remember, a test is only information at a point in time. So the safest way for us to do this is to have people in quarantine for 14 days so that we can monitor and help mitigate the spread.
Thank you, Drs. Holden and Shoham. I would like to introduce you now to the Director of Student Activities and Greek Affairs, Marissa Lucchesi, who will speak about the student experience.
Good evening, everyone. As many folks on this call are already aware, Student Activities and Greek Affairs manages all undergraduate engagement for registered student organizations, sorority fraternity life, commuter student life, signature programs like our senior send-off, and other signature programs like comedians, lectures, and other late night programs that we're really well known for. I want to take some time tonight to really encourage our students, faculty, and staff to establish a profile on LU Community. This was our online engagement hub that we established for the fall semester, and it was very successful for us. This is where students signed up to attend events. This is where students registered to vote, and it's also where our registered student organizations registered to be recognized on campus. This is where we hosted our registered student organization fair as well. So it's a great space to join organizations, make new friends, and even apply for leadership positions. So that's definitely something that we're going to continue on with in the spring semester, that you'll be able to continue to sign up for events. Student organizations will be able to continue to apply for funding to host their virtual events. So it's definitely something I want to encourage folks to be a part of. The second thing I want to remind folks about is joining a student organization. We have a lot of students on campus, a lot of students virtually who are concerned about making friends. Like I said, we have over 100 registered student organizations that are active and they've been hosting events. They're going to continue hosting virtual events in the spring semester. I also want to encourage our students to consider joining a sorority or fraternity. All three of our councils will be hosting formal recruitment during the spring semester. We've received a lot of questions about Pan-Hellenic recruitment. I'm very proud to say that the team is working super hard to make sure that all of our students who choose to participate in recruitment this semester have a great experience. It's going to be entirely virtual over 4 days from January 28th to the 31st. If students have questions about going Greek, I definitely want to encourage them to check out our Instagram handle. The Instagram handle is Loyola Saga. You can get more information there. I know that our seniors are also very concerned about their senior experience. I want to just note that and just own it. We are in the process of hosting focus groups with the Provost office to create a kind of a streamlined experience for everyone. So we are going to be continuing to host signature events as well, both on campus and virtual, to engage with our graduating seniors. And finally, for students who need some additional support, even if parents or staff have concerns about students that they're engaging with, I do want to highlight our Center for Student Assistance and Advocacy. This is where you can get personal concerns addressed, Title IX issues addressed, any concerns addressed regarding COVID. That's another resource that comes out of the Division of Student Development where Saga is hosted. Thank you, Joyce.
Thank you so much, Marissa. So I have one big burning question from students. They would like to know, will registered student organizations be allowed to have in-person meetings, and in what capacity?
Yeah, that's the question of the day. We've been working really closely with campus partners in addition to our student government, and we've outlined all of the possibilities that our student orgs can take part of. At this point, we're not able to support in-person programming and events, but student organizations will be allowed to continue hosting virtually and apply for funding for virtual events as well.
Okay, thank you. Thank you, Ms. Lucchese. I now invite Maddie Drescher, President of the Student Government, to offer some comments on the student perspective. Maddie?
Hi, everyone. My name is Maddie Drescher, and I serve as the President of the Student Government of Loyola Chicago. Some of the first years and their families on the call might remember me from convocation earlier this year. I spoke at that briefly. As I mentioned, the Student Government of Loyola Chicago, the SGLC for short, we serve as the representatives for the undergraduate student body at Loyola, and our organization has been fortunate to continue operating remotely since everything shifted online back in March. I'm fortunate to work with some of your most dedicated and driven peers. A little more about myself, I'm studying psychology and political science, and I'm a senior this year. And as you could probably imagine, being a senior this year has come with its collection of challenges and losses and experience of what I expected. I conceded a while back that my senior year, at least as I expected it, was gone. And I've grieved that, and I'll continue to grieve that, but I know it's in the interest of something much larger than my senior year. It's in the interest of something much larger than any of us, really. And I know we've heard a lot on plans and backup plans for the spring. We've heard some of what we don't know yet either. And, we're in an acutely unique position being located in such a densely populated city that leaves a much greater number of those unknowns or uncertainties than some other schools, even across Illinois. I'm with you, trust me, I'm with you. And of course, wanting to know every detail about what campus is going to look like and what spring means for Loyola. I'm a student too. I would love to be on campus with my friends again. I'd love to be in a classroom with my professors. I'd love to be walking across the stage in the spring to get my diplomas. I want answers as much as the next person, and I can't even imagine what it's like to be a first-year student right now and your family, trying to navigate an online college education, trying to connect with others and make friends and have those first-year experiences, some of which that we know just can't be replicated online. Part of my job in student government is to speak with administrators and staff and faculty across the university, trying to convey even the slightest glimpse of what students are going through right now. Let's call a spade a spade. I'm tired. I know you all are tired. This sucks. There's no sugarcoating that. I'm with you. I am COVID fatigued. I'm spending Thanksgiving away from my family and with my roommates instead this year. And there's a chance I'm spending Christmas and my birthday alone. So I'm with you. But no amount of planning and backup planning or even testing from the university can prepare us for a semester or a year if we don't care about that bigger issue at hand. If we continue to value our college experience as we imagined it above that of more than 250,000 dead Americans, those people don't get another holiday with their families. They don't get another holiday period. This planning doesn't work if we're more concerned about partying with our friends than their health or the health of their and our loved ones and the lives of people we may never know. Over the years, I've had the pleasure of working a lot with incoming students and first years in different capacities on campus. I know that so many of us were drawn to Loyola for its mission in social justice. And if we weren't drawn here because of that, we were drawn into it once we got here. So, we as students, we can talk a big game. We can talk all day about being people for others. We can preach and we can march for every social justice issue until we're blue in the face and swollen in our feet. But it's no secret that this pandemic disproportionately affects Black and Brown communities. Rogers Park, where Loyola's Lakeshore campus and the majority of housing that's being offered is located, is one of the most diverse communities, diverse neighborhoods in the city of Chicago and in the country. And as far as I'm concerned, and I include myself in this, students, if we're living in Rogers Park or anywhere in the surrounding area for our time being at Loyola, we're guests here. We are guests in this community. This isn't our home. Right? We can't preach social justice and then walk the streets of our neighborhood, passing families with kids and elderly neighborhoods without wearing a mask ourselves. If the kids down the street playing outside today can wear masks in their own yard with their own siblings, then we should be able to as well. We don't get to have it both ways. We can't have our cake and eat it too here. This goes far beyond an excuse of, Loyola students were young and healthy for the most part. We'll recover or we'll just be asymptomatic if we do get it. When our age group is likely to contribute to COVID community transmission, that doesn't work. That doesn't add up. There are people dying from weddings that they weren't even invited to. This pandemic and its dangers are not opt-in for us. We don't get to have 8 people in our apartments when the city limit is 6 or 12 when it's 10. We're not excused from the rules because we're feeling inconvenienced, and we don't get to have parties because we feel like it's unfair and we're missing out on what we thought our college experience would be. Our selfish actions right now are costing lives that we may never see or know about directly. Our actions have irreversible consequences, and we can continue to pretend like they don't. We can continue to make excuses for our friends and ourselves and that my friends are being safe and we're not going to get it. And I'm only seeing 5 of my friends, but I guess I don't really know who all they're seeing. So we can plan, and Loyola can offer 1 million webinars articulating 1 million different scenarios for what the spring might look like for students based on national guidelines, state guidelines, city guidelines. None of it matters. None of it matters if we don't start taking some personal responsibility for our actions. This isn't going away in the next few months. We're only going to get more lonely and more fatigued and more frustrated if we can't manage to follow these guidelines and precautions to engage with each other safely. And trust me, I know that personal responsibility is not the only factor at play here. There's obviously a fluctuating national, state, and city situation that Loyola and we all as individuals are trying to merely respond to safely. But we do have control over how we respond to those situations and how we try to act responsibly for the safety of ourselves and others. Younger students, particularly, first and second years. I'm sorry that this chunk of your college experience was glamorized to you by movies and shows. It's certainly not what you expected, right? And along the way, you all have been on the receiving end of some brutal, unexpected, but necessary decisions. I'm sorry. But there's time for you to still have those experiences, but they can't come and they won't come if we all around campus and those of you thinking of coming to campus can't prove that we can be safe in doing so. So I know that myself and other older students have a leg up with a few years under our belts and finding friends and community on campus. It's a lot easier to continue community online or remotely than it is to start it from scratch. So please don't take my plea to be safe and responsible as discouraging you from finding those communities that I and so many others have been fortunate to do at Loyola. What I'm asking is for you to do so creatively and safely. Director Lucchese just outlined a number of opportunities that you have to engage meaningfully with other Loyola students. There's seniors like me in organizations that are so excited to pass the baton onto a new generation of Loyolans that care about our organizations and our causes as much as we do. You have peer advisors, if you're a first year in your Univ 101 classes, that care deeply about that program and about all of our first years and your success in and out of the classroom. That's a community built in for you. If you'll be on campus, you'll have resident assistants, many of which I'm fortunate to call my friends, and I know they care deeply about your experience, your adaptation to campus, and especially your health and safety while you're here. And I know that they, as students, are working hard to adapt to this format for you, ensuring that there will be programming and community building among other students in that on-campus situation with you. There are retreat leaders in campus ministry who specifically program for first-year students to reflect on their experiences and build community in one another. There's student mentors and staff in student diversity and multicultural affairs, or SDMA, who invest so much time in building community among first generation students, students of color, our LGBTQIA+ community, and more. I know we are exhausted and we are burnt out from Zoom and staring at our computers all day. And it can be especially scary entering into that new space, be it class or an organization virtually. I could speak a little bit personally to this in terms of my experience in the student government this year. I am so grateful to work with as thoughtful of a team as I have in SGLC, but I didn't know a lot of the people that I now consider teammates and friends before this pandemic. We rally around issues that we all care about though, and we care about each other and our well-being, despite some of us never having met in person before. Forming community online is not easy. I'm not trying to paint it to be, again, I can't imagine what it's like to be a first year right now, but I know it can work, right? It does take some effort, some extra effort and vulnerability, but it can happen. And I encourage you all to lean into some of these established communities, some of which I've listed off, but more beyond that, to help you build your communities and expand on what you may have now. It doesn't have to look so structured either. I recognize that, scheduling a Zoom call with people you hardly know, awkwardly navigating your way through an hour of small talk and icebreakers maybe is not the most appealing version of building community out there. I get it. Forgive me if I'm out of the trend already and I sound old, but I would suggest a couple of my friends and I have an Among Us group where we meet up every week or so to play that game. But you could do that with your classmates or your neighbors in your residence hall. You could join a book club or a watch club where you can make the focus of the conversation on something you all read together or watched together as opposed to on you. I know students and parents alike are worried about mental and physical health and having access to those resources across campus, but they are there. And it's unfortunately not as in your face as an in-person semester would offer, but they are there and they're accessible online. It may take that extra outreach to see what sort of the format is online, but they are available to you. So there are ways to do this, and it's not going to be easy. It's not necessarily natural to us yet, but this creativity and caution are so incredibly necessary, especially so you all can get back on campus in larger numbers to see your friends and to make new friends. So you all can get on campus to meet your professors in a classroom, and so you all can walk across a stage to get your diplomas. This pandemic is bigger than any of us, but that doesn't mean that we can't make a positive impact in our own and in our community's collective action. So do the work now so you can get back on campus in larger numbers. And when you do, forgive me for getting a little sentimental here, but savor those inconsequential moments, or at least those that seem like it. Savor late nights in the library or the student center, accidentally missing the shuttle bus because you were too busy laughing with your friends in the dining hall, so now you're gonna be late for class, or savor squeezing past a row of chairs in a classroom with some poor interior design choices, but those imperfections of your college experience are what make it. And as hard as it may feel right now, or in general over this semester, I beg you not to wish this time away because it does go fast. Pay attention to the moments that bring you life and bring you love right now, and lean into those as your community. See how you can expand on those. It's very easy to focus on what we're missing and what we've lost, but I challenge us all to think about what's been gained in our identities as people for others. I challenge us to consider the ramifications of our actions that go far beyond our line of vision, and to do everything that we can to preserve our health and safety for ourselves, for that of our loved ones, and especially that of people we may never meet. Thank you.
Thank you, Maddie, for those very thoughtful and heartfelt words. Thank you so much. At this time, I'd like to invite Dr. Rooney back for a thank you and for some closing remarks.
Thank you so much. And thanks to everyone who has joined us and connected with us tonight and also shared your questions. Yes, there's been a great deal of information shared, but hopefully you have found it helpful in understanding some plans for the spring semester. And the information will be available on our website, and this webinar can be accessed by anyone who wants to view it again who was unable to attend this evening. I echo the thanks of the details and the information for all the panelists, and I especially want to thank Maddie, our senior. You were able to shape the type of detailed information in such a way to say, yes, it's going to be hard. No one's making that anything less than it is. But on the other hand, it could be so positive and it could be a great experience. And I hope everyone listening tonight does get a sense of both the passion and the commitment, not only of everyone on this webinar tonight, but of all of our colleagues and team members with whom we work, because we really do want this to be a successful, great spring, different, one that's going to take all of us working together, and one that's going to take all of us, again, recommitting to, as Maddie and all of us said, our Jesuit mission of really caring and awareness for each other. But the benefits are going to be far, far greater than the challenges and the inconveniences and even the differences that we're going to have to do to make this work together. I encourage everyone, again, listen to this webinar again and continue to stay in touch and get the latest information through our COVID-19 and Return to Campus websites. We will continue to provide updates. We have 2 future webinars coming up, one Sunday, December 6th, and we'll take a deeper dive on academics, including online learning, on-campus learning, academic resources, and facilities. How can you make this academic experience the best for you, whether you are taking classes online, in person, or a combination of both? Then on Sunday, December 20th, we'll continue to discuss health, wellness, and testing. And we'll have the latest information and anything that might be changing from tonight in November 22nd to December 20th. We'll continue again to discuss health, wellness, and testing and answer your questions. We'll go into more detail about those plans and procedures, but also, as you heard tonight, a little bit more about mental and emotional health, physical health, and again, our compliance with any state and local guidelines and the latest of updates or changes that we see. As all of us are approaching Thanksgiving, I do wish everyone a blessed, healthy, and safe celebration in whatever form it takes. Again, thank you so much. We look forward to welcoming many of you on campus this spring and working with you and creating that special Loyola experience. Thank you, everyone, and good night.